Hi guys, today I'm going to talk about the second pair of cranial nerve, which is the optic nerve. And before going through the optic nerve, we should revise some fundamental important stuff. And I will revise them now with you. This is the anterior part of the skull, and here is the eye. Now, let's be more specific. Here's the eye, which is called the orbit. And now, this part is the optic canal. Look, this is the optic canal here, and this one is the superior orbit fissure. This one inferior orbit fissure. So again, optic canal, which is the optic nerve that we are going to study about today, will pass through here. Here's the superior orbit fissure. Here's the inferior orbit fissure. They have nothing to do with the optic canal. The second thing that you need to know is from the inside of the cranial nerve, when we remove the clavier, the top of the skull, here is the optic canal. Here. Here's the eye. As we know, there's 3 layers of eye. There is fibrous layer, which is sclera. This is sclera, and the cornea. This one is the cornea, and the vascular layer, which is choroid. This is the choroid. Continue with the ciliary body and the iris, and the third layer, which is the optic layer. So the eye contains 3 layers: fibrous layer, which is the sclera. This is the sclera, and the cornea. These two makes the fibrous layer. Now we are having the vascular layer, which is the choroid, with the ciliary muscle or ciliary body, and the iris here, this one. And the optic layer, which is this makes the nerves. Here's the cone. The cone, a rod is distributed around it. And from this part, look here, this is the optic nerve. Here, emerges from this part. Now, we've seen an important pictures, and now let's go to the more important part. Here is the eye. Here is the optic nerve that we talked about, which is passed through the optic canal that we talked about, which is here. Optic canal here, and here from the anterior side here. Now it goes here and makes optic chiasma. These both makes optic chiasma, which is better viewed here. Here. This is the optic chiasma. Don't mix with the olfactory bulb, or the olfaction, and the optic chiasma. And if you can notice, it's cut from here, the optic chiasma. Here is the optic chiasma. So now here will be the optic nerve, comes here, making the optic chiasma. And I will describe and explain what will happen on optic chiasma. Usually here in the optic nerve, we will have lateral fibers and medial fibers. When we come close to the optic chiasma, the medial fibers will mix and change their positions. Look, this here, this one will come here, but the lateral part will stay in its own position, or its own side, sorry. Here continues, and this exchanging of locations makes the optic chiasma. Okay, now when it goes through the optic chiasma, it loops around the pedicles, cerebral pedicles, and here the journey starts. Cerebral pedicles. Wait. Here are the cerebral peduncles. It loops, look, the chiasma. They loop around the cerebral peduncles. Then look what will happen. After that, they will go to the cortical and the subcortical center part of the vision. The cortical center part of the vision will be like this. They will go to the lateral geniculate of the pulvinar part of the thalamus. And I will show you the pulvinar part of the lateral geniculate now. Here, pulvinar part of the thalamus, lateral geniculate. And we know all where is thalamus located. There is no need to show you. Now, lateral part. When it goes to the lateral part directly, then when it goes to the lateral geniculate of the pulvinar part of the thalamus, it goes then to the cortical central of vision. Cortical center of vision. This is the first strip. So when we finish the optic chiasma, it goes to the lateral geniculate and directly then continue to the cortical center of vision. Cortical center of vision is sulcus calcarinus or calcarine sulcus. Calcarine sulcus, I will show you where is the calcarine sulcus. Here, this is the medial part of the brain, and here is the calcarine sulcus. Here is the central optic cortical central optic vision. I don't know what is it. Cortical central vision. Anyway, this is the first strip. The second strip will go to the subcortical. We said then it goes to the cortical from the lateral geniculate. Now, here it goes down to the superior caniculi. Superior caniculi. Here is the superior caniculi. This is the medial surface of the brain. Here's the superior caniculi. And here it stays, which is the subcortical part of vision. And that's it. So let's make a small revision. We said, first of all, I know it's a little bit not complicated, but it's long. First of all, here's the eyeball. From the eyeball through the optic canal, which is located in here, comes from here, optic canal. Then it goes to make something called optic chiasma, which is located here. Make this. Then it loops around the peduncles to go to cortical center of vision and subcortical center of vision. The cortical center of vision, which is, it'll go to the lateral geniculate of the thalamus as I showed you. Then it go to the medial surface of the brain, which is the calcarine sulcus here, which is the central cortical center of vision. Then the second strip will go to the subcortical center of vision, which is the superior caniculi. So first strip, it goes to the lateral geniculate, then it goes to the calcarine sulcus, which is the central part of cortical center of vision. The second strip, it goes from the optic chiasma and goes to the superior caniculi, which is the subcortical center of vision. Now, you need to know something. First, here, for example, this is the optic chiasma, right? This part will be called of the nerve. I know it's cut, but imagine that there's a continuation here from the eyeball there. Okay, this part called optic nerve. Here, optic chiasma. Then, when it goes to the cortical and subcortical center of vision, these pathways called optic tract. So, optic nerve, optic chiasma, then the continuation optic tract. Okay, thank you very much.